I think one of the biggest problems overall is a lack of vision for the region. We have a very divided county. We have a county that is split geographically, both physically and then politically, and spread out and carved out by agricultural boundaries, etc. What that means is we don't have a coherent vision of what we want to be as a community. And the people that suffer the most for that are the poor people and the people that we're trying to help. But because of it, there's a lack of political will and commitment on the part of stakeholders to say, this is what we want to be in 20 years from now. You know, we want to grow by X amount of people. We want to have this amount of assets developed in terms of healthcare, in terms of schools, in terms of equity, and all kinds of ways that we can be supporting the region. So I mean, one area that Cottage could be helpful is helping to articulate a vision for what it is we want to be looking like 20 years from now.
I commend Cottage for being an institution that's asking the question. Because whether it's housing, transportation, poverty, unless institutions like Cottage lead the way, then all of us crafty, smaller organizations that aren't the true institutions in our community, we will be left to our own devices. And the way the system is now, we're left to our own devices just to survive. So the leadership of Cottage on these issues, I think, is critical, and I wish that other institutions would step up in a bold way and provide housing like you do for the nurses.
But I don't know that we've done enough education for all of these issues so that the community can start to coalesce around, you know, what really are our three biggest priorities. And maybe this population health dashboard could really highlight some things like, wow, nobody knew that this particular issue was so great, but in fact, it's solvable if we do these 5 things. If any county in the country is going to do that, Santa Barbara County can certainly do that.